Your classic glycolics are great because smaller molecules, they penetrate faster, deeper. The stimulation of the collagen production helps to improve elasticity, and it does target the lines as well.
Welcome to Beauty Babble. So, we have been doing a series on chemical peels and common skin conditions. Today's our final, and we're talking about mature skin. We left the best for last.
Common one, but why is that?
Right. Yes. Well, we can just kick off by just at least first defining mature skin, right? Like everybody has a
Mature
different
skin,
idea of what that is.
right? Exactly. I have 20-year-olds say that they have mature skins,
hmm
year olds that say they don't have mature skin.
that's interesting.
Yeah, it's not an age thing. It's
That's
really what
right.
you see in front of you, right? I think that's a
hmm
huge part because we're all aging. The
Yeah.
moment we're born, we age.
Yeah.
Or that whole cell renewal. But yeah, I think let's classify when we look at our things that we can look and as guidance to help us to remember those things. What was that scale called? The Google?
Glow glow glow
Glogo.
glogo?
Glogo.
We might be butchering it. I'll put it in the comment in the description, but it is a classification of photo aging. And so what you see is what you're going by, right? Like you're looking at the visible indications on the skin.
Yes. And well, we might as well talk about them. There are
Yep.
four
Four.
basically on that scale, right? So the first one is mild and
So the first one
typical,
is type 1 and it's called no wrinkles.
right? Typically an age, typically 28 to 35, but it can vary, right? It depends on, this is just a
Mhm.
guideline if you wish. So they say ages, but if you're kind of wondering about more of what like you said, the visual side of things, mild, very little in any pigmentation changes, would you say?
Yeah. So this one would be like, yeah, like you said, mild pigmentation. There's no age spots, no
No
wrinkles, no
wrinkles.
visible wrinkles when your face is not moving. This is what we would look at and not think mature skin.
Yes,
Basically, if
exactly.
we this is where we all want to stay.
Yes.
But we move on to the second type would be type 2, and this one is called wrinkles in motion. This is according to this scale of
Google.
classification, but I mean, it doesn't matter what you name it, it's what it looks like. So for this one, it's like any 30s and 40s, but that's 20 years. Like so it's not really about the age as much as it is about what you're seeing. With this one, you're looking at changes in skin texture, like early changes in skin texture, those like expression lines, right? Like where you
Mhm.
smile and you get your little
Wrinkles in motion.
yes. Yes.
Yes, when it's moving. And you start to see the pigmentation, right? The
Mhm.
hyperpigmentation, some
Yep.
spots. So I guess you could say like typically the smile lines, the
Around the mouth.
eyes, the eyebrow kind of thing, right?
Mhm. Yep.
Yeah. The third one,
And I think before we get to that one, I think this is the one where when it comes to these type like chemical peels and clients, this is where I've seen the most of client range, right? This is where
right?
they're like,
That's
"Oh my gosh, we need to start doing something about this."
yes, true, true. Yeah.
And then type 3, which would be wrinkles at rest. And this is if we want to put an age to it, we're going 50 and over. But this is where you can see visible wrinkles without movement in the face, right? So we're beyond those expression lines.
And you can see the obvious pigmentation. It's not like you're really looking close, like you can actually
Yeah.
see those
Yep.
areas, probably texture wise as well.
Texture.
Change. Yeah.
Yep.
So
And the last one is type 4, and this is I love the name of this one. Only wrinkles. Like only wrinkles is
maybe
nowhere I want to be.
maybe I wouldn't tell my clients this. Oh,
No,
you're wrinkled at rest, gal. Oh, you're
and
only wrinkles.
right? And
Wrinkles
this
in
like
motion.
60s or 70s, I feel like I'm looking at a picture on this website about this, and I feel like I know women in their 60s that this they don't have these wrinkles. So I'm
Yeah.
gonna go older. This is older, but basically
Well,
this is oh right. It depends on lifestyle, right?
yeah.
Yeah.
And there's
I
some
saw
that,
your
when you look, they're like only in their 30s and they look like they're more like in their late 40s. It's
yes.
lifestyle. What do they eat, drink, sun exposure, stresses of life,
Yeah.
autoimmune medications, like you keep naming it. And so
Yeah.
this is a guideline
Mhm.
so that, you have something to look at.
And this one for me, like it's just also deeper wrinkles. It's not just about like they're just more pronounced, they're a lot deeper. When you get into this phase of skin aging, it's like treating with a lot more caution because those wrinkles are deeper that it creates a lot more challenge and you cannot kind of have that consistency in how much you're actually applying onto the skin because there's that pooling and whatnot. So definitely a pause before
Mhm.
considering clients in this phase.
Very true.
Because
Yeah.
too, like, are you able to help them reach their goals with the level with as deep as we can go in terms of our scope of practice? Probably not.
Right. And the other thing too is, I don't know, I always look at it, it's not just one treatment is the plan.
Mhm,
We have
exactly.
so much at our hands nowadays that we can incorporate to change, but we're only talking chemical peels, so we'll stick to that. But I'm just saying, it's not just the chemical peel, it's what other things can you do with it. Chemical peels I always look at as like that, like a hard kickstart almost, right? But yeah, so I mean your classic glycolics are great because, smaller molecules, they penetrate faster, deeper. The stimulation of the collagen production, helps to improve elasticity, and it does target the lines as well, right? So overall, even tone, those
Mhm.
types of things. I mean, I think everyone who does facials and has their base of chemical peels, to go back to your knowledge and just remember, why would you choose glycolic? Why are you going to choose a lactic? you
Mhm.
know so lactics are still hydrating, they're larger molecules, it'll be a slower process. Like, it's again the why behind what you're doing, instead
Yeah.
of just everybody's going to get, I don't know, TCA, everyone's going to get a glycolic from me. If you're doing chemical peels, you should have a range of chemical
Mhm.
peels, not
Mhm.
become chemists and start blending things. But I'm just saying, then you can offer one treatment, could be a glycolic, and then in the next one, whenever you plan that out, could be the lactic. Like, there's a variation to it. And I should say on that note, doesn't mean you have to have all of the types of chemicals. But if you do, utilize them on the
Mhm.
knowledge that you were taught how to use them and based on what you see in front of you of the skin, right?
Yeah. I think another really important consideration for treating mature skin is not just like identifying their where they are in terms of their level of mature skin, but understanding how did you get to where you are? Because how do we get the skin that we do? Is it there's like that sun damage. That's a big skin ager. There's stresses and skin like conditions, like medical conditions that can so there's so many factors at play. And all of these talk about I'm mostly going to harp on the photo damage. Like this is really talking about somebody's lifestyle and how they are going to care for their skin. It could be in my 20s, I was very loosey goosey with my sunscreen, but now I'm very committed, and that's different, right? So,
Mhm.
really understanding like how did we get here in terms of like what have you been doing? Where do you want to go? And why are you like why are we even considering this? Is being
Love that.
a big part of it.
Yeah, I love that. It's totally, you have to get your clients involved in this. They
Mhm,
have to make the commitment,
mhm,
not just a general facial. I mean, even with facials, I still want them to commit to something, but this is definitely on another level. And I think that honest conversation with your clients, they're not going to want to hear what you have to say sometimes, but I think it's essential for your rapport with your client on that professional level to be honest with them have empathy to them too, but being honest is like, have I said no? Yeah, I have said no to people, but I
Mhm.
don't just say no, you don't qualify. It's like, okay, I want to talk to you about this. And maybe it's just timing, right? I think I've said this before. I think right now, I just really want you to consider, well, why do you want to do this? What are your expectations? And what are you willing to do at home? Because this is not just about this treatment right now I'm doing with you. But that would have been in the consultation anyway, so you would have known if they're going to
Yes.
follow through. But, I
I
think,
actually sorry to
no,
interrupt you,
go
but
ahead.
on that note, like, I think if you don't think it's a good idea as the professional, I would not do it at all.
Mhm. Yep.
Right?
Correct.
Like, not,
Absolutely.
even if you say if I, like, have this, like you're gonna know your client a little bit, hopefully, that's not their first visit, and you we say this every episode, you know them enough to know, like, if you're sensing, like, you're not comfortable with this, I would not do it, and, of course, yes, diplomacy, don't say no, offer a different treatment,
Mhm.
but I wanna, like, side note, I'm gonna go into an off story. I saw this on TikTok the other day, and it was like it's kinda like Judge Judy, but it was a different judge, and one girl who got her eyebrows microbladed was suing the professional because she came in with a picture and she's like, "I want these eyebrows," and the professional said, "That's not a good idea, it's too dark for you," but she still did it because the girl insisted and insisted, and she hated them because it didn't suit her face. Anyways, she lost, but the thing is,
Wait,
the
who lost? Which
professional
one?
the
Client?
client, the judge was like, "No," because there was paperwork, first of all.
Oh,
Everything was documented, so there was that.
yay. Good for that
Um,
professional.
she did I mean, she did her part, but I think I was a little critical because I'm like, I would have just not done it. Like, I don't think that you should do something that you can't stand by professionally.
It's hard for some people to say no, though.
It
And
is,
I
but
think that's one
especially
thing in our industry.
yeah,
Yeah, and
this
I've
chemical
had those
peelings.
conversations with people say, "You have to," but just tell them why,
Yeah.
you
Not
know?
right now. Maybe I do this with my kids. We'll see, but maybe find a professional way of saying we'll see and like, oh, we can
Mhm.
work towards that. But right now, this is my professional opinion. But I think that comes with a risk of losing that client, losing that income. A lot of that might come to us as a fear, right? Like, oh, well, if I say no,
Yeah,
they're going to go
yes.
somewhere else or they're not going to want to come back and see me.
Mhm.
But again, like you said, explaining it. And at the end of the day, doing what you think in your conscience is the right thing to do.
Yeah,
Always
and I mean, and I said it, like, I know I've said this to clients when I've had to say, I'm being direct here. I didn't say, "No, we're not doing it," like that, but I said, "I know you're so disappointed. I apologize. I would love to do this treatment for you. Honestly, I would, but here's my concerns."
yes.
And really explain to them why. It's like, like you said, maybe it's a timing thing. Maybe it's like, like I said before, it's happened where it's like, well, I really want to do this, but you're going to go on a vacation to the sun for 2 weeks and you're golfing for most of it, for example, right? Like
Yeah.
it's just the wrong time.
Mhm.
But you know what we can do for you so you can get the glow of your skin and recommend something else, because in the end the goal is what's the point anyways. It's the point is the goal.
Exactly, yeah.
Then go back to the goal of your client, and without using the word no, it's like, I have a different treatment for you. And
Mhm.
it takes time to build the confidence to be able to pull that out of your hat really quick. I get that, but at the same time, I think they'll appreciate it more so from you as a professional, right?
I
Um,
agree.
and there's some people, yeah, they're pushy. They're
Yeah,
nobody really want like the. I was really happy to hear that she lost,
she did lose.
and because the
Paperwork makes
professional did her due diligence, paperwork, paperwork, pictures, all those things, and to have the audacity to turn around and sue them when you asked for that. This is unfortunately our world we're in right now.
yeah.
So
And I
please,
think that was, like, states-based, so a
yeah,
little different. I don't know, like, our
it's
Canadian listeners,
TV too,
international
right? So
listeners, it might be different, but I think in a scenario where that lady would have said no to the client, and then that client would have gone somewhere else and gotten what they want, then they would have been mad at somebody else.
Yeah.
But I think, taking back to chemical peels, like if you offer an alternative solution and they still go ahead somewhere else, any negative, like maybe it turns out for them, maybe it doesn't, but it's
Mhm.
your it's you have to just do what you know is right.
Yeah, yeah. No, it's a good point. It's a good point. Other things to consider too when you are working with mature skins is that side of post treatments and how you're going to nourish the skin. All take advantage of what you've just done. So the skin is starting to absorb those nutrients.
Mm.
So think of, your hyaluronic acids, your peptide, niacinamide's gaining, you know, momentum, if you wish, because it helps to also, not only does it bring circulation up, but it also helps to improve the skin barrier too. So there's a lot of things to the other ingredients that are out there
Mm.
of the focus. And if you explain to your clients the why behind why peptides, well, it's going to help support the elasticity of the skin and the collagen production. Vitamin C, it's going to fight the free radical damage, or like use your knowledge. Like everyone has been taught these things, but it's just so much information. But how do you spew it out to people? So you almost have a checklist even to get going, like saying, hey, mature skins, I really want to make sure we have a few of these ingredients, which your products do right now or don't have.
Yeah, that's a good idea.
The other thing too is having a coughing fit here,
Take your time.
is how often you're going to do it, right?
Mhm.
Recovery time and the long haul of this, right? Like, so you think of, can you do LADs in this treatment? Can you offer things with them? And that's almost anybody, really, any kind of skin condition. But really, the aftercare too is like talk to them about those nourishing nutrients after, because it's not acne, it's not like other things that are going on here. We're really targeting about that mature skin and slowing down the aging, trying to help them with whatever stage they're at. But chemical peels are not just the one answer. And I think
No,
that's something we got to remind ourselves of
I
if you
think
want to be that.
with aging skin too, or sorry, mature skin, um, just taking into consideration if your client has Botox or filler, that
Right.
that is still that's not a no. Like you can still do a chemical peel, but there has to be like a time in between. So if you're doing a treatment plan, like making sure you're informing them to plan it out. So when they're getting their next Botox, it's not around the same time that they're getting their next
Mm.
chemical peel and so on and so forth. Just giving them that information as well.
Well, yeah, and that comes with all of the skins because 20-year-olds are doing this,
That's true. Yeah,
right?
that's
So I think it's
always
a
remember
good
to
reminder to talk to them about it.
yeah.
Perfect. Well,
I think
I
we
think
covered
we're ready.
everything. I think
Yeah, I think so.
this is the one where I think I've done the most in this age category or this skin condition, I should say, when it
Yeah,
comes to chemical
definitely.
peeling.
Hmm. Hmm.
Yeah, I think we covered it all.
I know everyone's probably like, but you didn't give direct answers. And that's the whole point of this. There isn't an exact answer to this.
Well,
in
it's
any,
yes,
well, yes, you can do
yes,
them,
but
of course. However, how to do it, how long do you leave it, which one do I pick? There isn't a direct answer. I don't feel. I think you really got to look at the skin, like we've talked about this before. What's in front of you? What do you see? What is their lifestyle? What are they, as you said, stressors,
yeah,
or now with so many autoimmune health conditions out there, and what else is going on? Like somebody that can't have gluten has gluten, they get inflamed. Is that the trigger? There's so many things that could be
yeah.
the cause. So you really need to do your part as a professional and dig out as much information you can out of them, but tell them why. I
Mhm,
think that's what we miss sometimes, is just explain to them why you're asking these things, because you want the best result for them in the end. This is an investment that they're doing and they're trusting you to do it. So I think you
mhm.
communicate a little bit better.
I think so, and I think it always comes back to your client's skin care goals, and how do you help them reach that goal with as little complication and risk as possible. That could include chemical peeling, but chemical peel seems to is never the default answer or the first thing that you would go to. It could be part of a treatment protocol that you would lay out long term, but
Mhm.
it's never, in my opinion, I'm going to say this, it's never the first thing you do. I'm just going to say, in my opinion, it's
Mhm.
never the first thing that you should do because you should really get to know your client, get them in for a facial and then start them on their pre-peeling and then you could do a chemical, like, you know what I'm saying?
Yes,
So
I completely understand what you're getting at. It's not the first one you're gonna like when people call in and say, I would like to have a chemical peel. Okay, and you've never done a treatment on this person ever.
yeah, that's
So
scary. That some
complications.
places do that. Some people do that, and this is like no judgment, but would I do that? No, I wouldn't do that. And I think you just have to our listeners, like, what do you want to do? And then doing it with caring for your clients and their skin and
Mhm.
not causing them any kind of damage. You don't want to end up on that judge show, whatever it is,
Right?
not Judge Judy.
Yeah, and I think like you touched on that saying maybe that is your business. That's what you do. You specialize in chemical peels and you're confident in doing great. But I'm sure that you're not going out and just starting off with a 30 glycolic on them. Like I would trust the fact that if you're at that stage of this type of a business, you would have a lot of options. This is more directed to people in this industry who you know, maybe they have a lot of different types of treatments that they offer. Chemical peels happen to be one of the facials that they offer, and they
Mhm.
just call it advanced chemical peels. So that's kind of what we're gearing to. But if you're an establishment and your specialty is advanced peels, well, then you already have your protocols in place. I'm pretty sure that you're not just randomly doing someone off the street the first time ever and just banging out, like I said, a high peel because you got to do the pre-treatments, you got to know the skin, the
Yeah.
whole thing. But this is gearing to our fellow professionals out there who, they do hydration facials, they do, I don't know, microneedling, they do advanced peels, they do acne facials. That's how they name their menu. So this is what this is kind of gearing to. It's like you have advanced peels, and that's all you call it. It's your one treatment, advanced peels. So
Yeah.
that's what we were kind of referring to. So, you know, if you are an establishment and you do chemical peels, that's your jam, that's your niche, that's what you do, then I'm pretty sure you're doing it right. Like you know what you're doing. It's just these questions that have come up in this last little while for us is why we brought this series on, because this is directed to the technicians out there that are not doing regular chemical peels all the time and kind of forgetting what to do. So
Yeah.
that's kind of what we kind of brought this out to.
Absolutely.
Yeah.
And we're always open
Thank-
for topic ideas and suggestions. So let us know what you want to hear next. Thanks for listening to Beauty Babble.